Sleep disorders are anything that can fragment, impair, or change the normal sleep pattern.
They basically can involve being too sleepy, not having enough sleep, or not being able to get to sleep, having disrupted sleep, and as a result, feeling not rested.
There are literally over 80 sleep disorders classified that can be diagnosed.
The most common sleep disorders we see are insomnia, obstructive sleep apnea syndrome, and restless leg syndrome. Insomnia, there's two major types. You've got sleep onset insomnia and sleep maintenance insomnia. Patients with sleep onset insomnia have difficulty falling asleep. People who can't stay asleep have sleep maintenance insomnia. Obstructive sleep apnea syndrome is a disorder involved in the person's throat collapsing too much as they sleep, causing not enough air to be able to get to the lungs. And that can happen over and over. These periods of obstruction or airway collapse can last anywhere from 10 seconds to minutes. And in people who are severe, can happen more than 30 times an hour. Restless leg syndrome is a disorder involving someone having sensations in the legs that are unpleasant at nighttime. Usually it's occurring right when they first lay in bed.
The primary reasons why patients usually seek help for sleep disorders, one is their quality of life. They wake up unrefreshed, they're struggling at work, it can affect relationships.
We often hear a patient coming in specifically for snoring because it's so significant. They're having to sleep in a separate bedroom.
And it usually isn't just monotonous snoring, it's interrupted periods of silence with gasping, coughing, choking. The patients typically don't even wake up. They're doing these without knowing what's happening in their sleep. So their sleep is fragmented and it's interrupting their partner's sleep.
There are many medical consequences and risks related to sleep disorders, as far as cardiovascular complications, diabetes, hypertension, stroke. There are also worsening mood disorders we see, commonly depression, anxiety. We can also see attention deficits, poor concentration, and sometimes even kids are misdiagnosed as ADHD.
It's extremely important to us to be able to evaluate the patient and do a detailed history and physical to know why they're there, so we order the appropriate study. I think it's important that patients come to a place where they feel comfortable and safe. We have a 4-acre facility that's in a very nice neighborhood that's has security, well lit, ample parking. They arrive to the sleep lab that night. They ring a doorbell for the tech to come greet them so we know who's at the door. They're escorted by their personal tech to the room.
In the beginning of the test, they're actually introduced to CPAP masks in different styles, so we can determine which one would be a favorite to try, especially if we need to treat sleep apnea that same night. Then they will be hooked up to multiple sensors, approximately 20, head to toe.
Most patients are a little reluctant to go to a place to sleep where they know they're being monitored anyway. But we take extra efforts to make them feel comfortable. So our rooms are designed with individual thermostats for comfort. They all have private bath and shower, some of the comforts of a hotel. Should a patient need treatment the same night, if it's obvious, there is really no reason to watch a patient the entire night with significant obstructive sleep apnea. If we have a confirmed diagnosis in the first 2 hours and we have criteria for that, we should treat the patient the same night.
Let me show you your sleep study. So the night you were here at the Georgetown.
When a patient comes back to review the sleep study results, we go over their study in detail. We show them what they sounded like, so for instance how loud their snoring was, and when they have pauses in breathing or reduction in breathing, that can be heard as well. We also review the heart rate as it proceeds throughout the night, and once they meet criteria for treatment, we'll be able to show them on their study that their heart rate can come down.
It is so gratifying to see that change in the quality of life by changing their sleep. And it's the cardiovascular risk and the other reasons that patients get referred are in themselves worth being evaluated if there's a concern there, just to know. But that aspect of treating patients is by far the most rewarding, where it restores relationships, where people become the people that they were 10, 15, 20 years ago. Their alertness, their personality, their irritability, their memory loss, the depression. You cannot function being chronically sleep deprived. And the ironic thing about the patients that we see is they're sleeping. They just don't know what they're doing. But our intention is to follow those patients until they're effectively treated and then get them back to their primary care docs with some good, happy news.